Yes, so here at the IMS in Rio, we had a chance to participate in a symposium discussing really how we can further improve the use of CAR T-cell therapy in earlier lines therapies for patients with multiple myeloma. We all know, CAR T-cells are, very impactful. We just had data being updated at this meeting. We're now including showing overall survival advantage. It seems far better than the alternatives of continuous use of doublets or triplet therapy. There's still quite a few things to improve on the safety, but also on the efficacy of those therapies. And a lot of that comes through understanding why those therapies don't work or stop working in some cases. Some of that has to do with target modification due to genetic changes that already happen in the cells and that are selected for or develop in the course of therapy. But also has to do with the immunologic fitness of the patient and consequently the cells that are manufactured or even the persistence of those cells. So we had a chance to review some of the data and how the persistence seems to be and the target loss seems to be two major changes, and how this can perhaps be mitigated in the early future through the use of double targeting, either by developing CAR T cells that share targets, for example, with GPRC5D and BCMA, but also with the intended sequential use on the same treatment plan, for example, of a BCMA-directed CAR T along with a GPRC5D-directed bispecific T-cell engager, or even the other way around, with GPRC5D CAR T-cell was currently in development in sequence with BCMA-directed bispecific. We also discussed some of the preclinical data and the exciting opportunity that the CELMoDs bring to the field of cell therapy. Those drugs are very active on their own as anti-myeloma drugs, but also they have important immunoregulatory effects that essentially improve the tumor microenvironment and can potentially lead to a greater activation and greater persistence of those T cells. And they are oral drugs, so they make it very appealing to develop those CELMoDs, for example, as a maintenance or concomitant therapy with CAR T cells. And that is fortunately being addressed in several ongoing trials, and we should have some good answers in a couple of years.